A new California law makes broad changes to the state's workers' comp system, including increased benefits to injured workers and cost-saving efficiencies. Harbor Health Systems is the first medical provider network to be approved and available as a network entity under the Senate Bill 863. Here to talk about the new law and the new MPN is Greg Moore, the president and founder of Harbor Health System. Greg, welcome to the program.
Thank you for having me.
So Greg, level set our audience. How does Senate Bill 863 change California's workers' comp system?
Senate Bill 863 was an effort by the state to streamline the workers' comp process, focus a little bit more on the injured worker, and try to mitigate some of the impact that third parties and special interests have had on the system, which has made it complicated over the years.
What brought these changes on?
I think the biggest driver was the fact that the state's seeing the cost of workers' comp go up, not necessarily on the care that's being directed towards these injured workers, but on the cost of managing the system, addressing the regulations, and meeting the requirements of getting a patient from point A to point B.
Does any other state have these provisions?
Well, this bill is unique to California. Each state has their own approach. As you know, the workers' comp system is a jurisdictionally based program, and there's a wide variance. California is very unique, though, in how it's approached this model, and the big impact that we focus on out of this is actually the MPN, which is a unique model specifically to California.
So what are the basic features of Harbor Health Systems?
Harbor Health Systems is a company that really focuses primarily on scorecarding doctors. We feel strongly that the best way to cure the workers' comp system is to focus on the quality of care provided to the employees. Any employee that feels like they're being well cared for is far less likely to take an adversarial position. And in curing that patient effectively and efficiently, you avoid a lot of downstream costs and problems that can impact the employer and employee relation, as well as the overall claim.
I understand you've included a concierge care plan for injured workers.
Sure. In the MPN model, and one of the newest regs is a medical access assistant, which actually aligned very well with the strategic approach we wanted to take towards providing a concierge level service to the injured worker. This is a very complicated system. Workers' comp is even more complicated than group health in many times. And the MPN that we're putting forward is a very tightly managed, very narrow network. So we want to make sure there's a resource available so that if an injured worker needs care, that they have a very easy phone call to place, and one person can be basically the same thing that a concierge would be at a hotel. If you think about walking into a hotel and you want to set up an evening out, that concierge is going to help you find what's the best restaurant for your taste or your desires, what's the best show. If you don't have transportation, lining up a car, and you really are counting on that person to just take care of all the details and make your evening easier. So that's where the name really came from, because we wanted to provide a 1-800 number where the patient can call in, we can identify what's going on with them, what do they need, and then we can line up all the different sequence of events that they need in order to get care effectively and efficiently.
Are there any other special features?
Well, one of the things that we've always emphasized in our MPM program is maximizing the use of best doctors. Harbor Health System is actually part of a large organization, One Call Care Management. One Call has focused on trying to bring together the best-in-class services across all the care that surrounds the doctor. So one of the unique things about Harbor One MPN is how we've been able to maximize this relationship to seamlessly connect the best doctors with the best overall care. And the way that we can coordinate care through companies that we're all part of the same organization makes it a much more efficient model and a much more effective at getting this patient what they need when they need it.
Thanks for joining us, Greg.
Thank you for having me.
For more information on workers' comp in California, visit the Harbor Health Systems website.